Hi everyone. Our today's topic is about fetal circulation. So before starting Doppler, it's very important to first understand about fetal circulation. So imagine you are in a busy, crowded city where everyone's rushing around, try to get from place to place. But instead of walking, there are super cool highways and secret tunnels connecting all the important spots in the city. So there are some special highways, some special tunnels in the city that connects important spots and avoid the unimportant. So now the baby's heart and blood vessels work like that busy city. Fetal circulation has its own highways and secret tunnels that make sure the blood is flowing to all the important places, especially the growing organs. And the baby's blood flow system is different from the adult. How is it different? Anyone? What do you think? What about lungs of the fetus? Lungs are not functional.
Yeah, the lungs of the fetus are not working because there is high pulmonary vessels, high resistance compared to the systemic vessels. So the lungs are not working.
Yes. So blood flow bypass the lungs. And it also bypass one other important organ. What is that? Liver.
Yeah, it's also the liver.
It bypass the liver. Okay. So we will see how actually it happens. So there is a structure, umbilical cord. Like there are 4 special structures. Umbilical cord, ductus venosus, foramen ovale, ductus arteriosus. These 4 are key structures here. Umbilical cord, ductus venosus, foramen ovale, ductus arteriosus. Now first of all, the umbilical cord. Okay, what is the function of umbilical cord? Anyone? Abdisa. What is the function of the umbilical cord? Okoi. Yilkal. Anyone?
Yeah,
Okay, Sanusi, please continue.
Okay, it supplies the fetus with oxygen and takes the waste away from the fetus.
Exactly. So it connects the placenta to the fetus. So placenta is kitchen. So it provides all of the nutrients, oxygen, it prepares everything. And then umbilical cord, it is the passage through which all of the nutrients, oxygen, they travel toward the fetus. Like it carries them toward the fetus and carries all the waste back to the kitchen, all the waste back to the placenta. So it's like a big highway connecting the baby to the placenta, And placenta is here very special organ in the fetus that gives oxygen and nutrients to the fetus. Okay, how many arteries and veins are present in umbilical cord?
There are two arteries and one vein, and the two arteries mostly take the deoxygenated blood, whereas the veins are taking oxygenated blood.
Exactly. So there are two arteries and one vein. And normally, like in adults, arteries carry the oxygenated blood and veins carry the deoxygenated blood. But here in the umbilical cord, vein carries fresh oxygenated blood from the placenta to the fetus. And there are two arteries. They take the waste like carbon dioxide from the fetus to the placenta. So veins carry blood supply toward the fetus, that is oxygenated blood, and arteries, they carry the deoxygenated blood toward the placenta. So arteries are like the exit route and veins are like entry route, like toward the fetus. So here we can see their image. We can see placenta here, which is the hero because it provides all of the essential things to the fetus. And here we can see the umbilical cord. So umbilical cord is like a highway which connects the placenta to the fetus. And where the umbilical cord insertion occurs in the fetus, where it gets inserted? Anyone? At the fetal abdomen, at the level of umbilicus, there is cord insertion. Now here we can see anatomy of the cord. So there is one large vein, as we can see here, and there are two small umbilical arteries in the cord. In the transverse section, on ultrasound, it looks like one large vein and two small arteries. In the longitudinal view, we can see again one large vein and two umbilical arteries using the color Doppler. So if we see only one umbilical artery instead of two, is that normal or something abnormal? Anyone? Normally, there are two arteries, as we can see here. So if there is only one artery, it means it is abnormal. Okay, now here we can see ultrasound image. So here we can see urinary bladder. Around the bladder, we can see two umbilical arteries are seen. So from where these umbilical arteries originate? Aorta further gives branches. Common iliac arteries, they are divided into internal and external iliac, and internal iliac arteries further give these two branches, umbilical arteries. And we can see here forming a V shape. V shape, two arteries around the fetal bladder, and after this point they further enter into the umbilical cord. So normally there are two umbilical arteries seen around the bladder forming a V shape, and if in this view we only see one umbilical artery, so it is abnormal. It means there is a single umbilical artery. That's one of the anomaly. So what is the function of umbilical arteries? Anyone?
It carries deoxygenated blood from the baby to the placenta.
Yes. Carries deoxygenated blood from the fetus to the placenta, and each artery courses around the fetal bladder as we can see here, and then it enters the umbilical cord at the abdominal cord insertion site. So for umbilical cord there are two insertion sites. One is abdominal cord insertion site and other one is anyone?
Placental.
On the placenta, the insertion
Yes,
to the
on
placenta.
placenta. Other insertion site is on placenta. Okay, so what we can see here? We can see urinary bladder here. So this one is a longitudinal view and this one is a transverse view, and again here we can see two umbilical arteries around the bladder, and then we can see umbilical arteries enter into the cord at the level of umbilical cord insertion site. So here we can see two umbilical arteries, and at this level they further join the umbilical cord at the cord insertion site. Okay, now here we can see transverse view or longitudinal view of the umbilical cord. This appearance is seen in the transverse view. It is also known as Mickey Mouse sign. So in the Mickey Mouse sign, we can see normal appearance of umbilical cord, and we can see here a large vein and two small arteries. So vein is like the face of the Mickey Mouse, and arteries are like the ears, two small ears of the Mickey Mouse. So this is a normal appearance of the umbilical cord. So if in this view we only see one vein and only one artery, so that is definitely abnormal. Now here we can see color Doppler image of the transverse view of the normal umbilical cord. So we can see here one vein and two arteries, again forming the Mickey Mouse appearance. Now here we can see the longitudinal view demonstrating that there are two arteries and one vein. So here we can see one vein and two arteries. So now my question is, when we perform umbilical artery Doppler, so usually we take the sample at which level? Placental cord insertion, abdominal cord insertion, or the free loops of the cord. Here we can see free loops in the amniotic fluid. So which of the level among three is the best to take the sample?
At the free lobe of the cord.
Yes. So we take the sample at the free loop of the cord level. So that's the important point here. Now here we can see image of the power Doppler, and again here we can see placental cord insertion site, and this one is the abdomen. We can see here umbilical cord insertion site, and here we can see free loop of the cord. Power Doppler, it only gives us a single color, and color Doppler give us two colors, so also tells us about the direction. Power Doppler does not tell us about the direction, arteries, veins, all show the same color. It just tell us about the presence or absence of the blood flow. Okay, so here we can see umbilical cord insertion site. So we can see umbilical cord insertion site at the level of fetal abdomen. And we can see here at the cord insertion site, it gives a vessel. Here we can see a vessel entering the fetal liver. What is the name of this vessel? Anyone?
Umbilical vein.
Yes. Umbilical vein. And here we can see again the transverse section, and we can see umbilical vein here entering the fetal abdomen. This is the same image, umbilical cord insertion at the abdomen, and we can see umbilical vein enters into the liver. Okay, now the next part of the story. So here is, we discussed about a main highway. That was the umbilical cord, and now further like it gives a branch, umbilical vein. Now what happens next? So there is a secret tunnel here. It is the ductus venosus. So once blood enter into the fetal abdomen, into the fetal body, it needs to go straight to the heart so it can be pumped everywhere, because now there is not much need of the digestion, because all of the nutrients are coming in a very soluble form from the placenta. So digestive system there is no much role of the digestion. So now we need the blood to go straight to the heart and bypass the liver. So for this purpose, there is a tunnel, there is another route, that is the ductus venosus. So instead of taking the long way, the fetal blood gets a shortcut. So ductus venosus is a special vessel that allows the oxygen rich blood skip the liver and go straight to the heart. We know liver is important, but right now it's not the most important organ because the placenta is doing most of the work. So ductus venosus takes the blood straight to the heart. So blood coming from the umbilical cord, it further gives branch umbilical vein, and this umbilical vein joins the ductus venosus. So this ductus venosus takes the blood straight to the IVC that drains into the right atrium. So it's a shortcut route. Through ductus venosus, we bypass which organ? Liver.
The liver.
Yes.
The liver to the heart.
Yes, we bypass the liver and it is directly drained into the right atrium. Now, in the heart, we also need a shortcut, and that is the foramen ovale. So, we will discuss the foramen ovale story as well. Now, first see the anatomy of the ductus venosus. So, what we can see here, there is umbilical cord. So umbilical cord gives a branch, we know umbilical cord consists of one vein and two arteries. It already consists of these three vessels. So one of its vessels enters into the liver and then it directly joins the ductus venosus. So it bypasses the liver, ignores the liver, although it enters into the liver. But now it does not pay much attention to the liver and leaves the liver. How? Because it joins the ductus venosus, and ductus venosus join here the IVC and directly drains into the right atrium. Now between the right atrium and left atrium, there is an opening. That opening is foramen ovale. So this foramen ovale lets the blood flow from the right side straight go to the left side. Okay, now in adults, what happens when the blood enters in the right atrium? In adults, what happens? Where it goes?
It will go to the left atrium, right? Left, right ventricle. From
right atrium to right ventricle, and then
to pulmonary vessels.
Yes, it goes to pulmonary vessels.
Enter the
pulmonary vessels,
circulation.
Pulmonary vessels, and then lungs, and then come back to the left atrium. But now here, the fetal circulation, there is a shortcut, that is foramen ovale, because in adults the right atrium receives deoxygenated blood, so it further goes to the right ventricle and then lungs add the oxygen, it comes back. But what fetus is receiving, that is the clean blood, oxygenated blood. So no need to further go toward the lungs, and lungs are also non-functional in the fetus because placenta is doing all the work. So lungs are taking just the rest now. So here, because it receives oxygenated blood, directly moves to the left atrium through which structure? From right atrium, blood goes straight to the left atrium through which structure? Foramen ovale. Yes. So foramen ovale is the opening here, which is the shortcut. Okay. So now our focus is on the ductus venosus. So here we can see umbilical cord, and then at umbilical cord insertion site, umbilical vein enters into the liver. Umbilical vein enters into the liver, and left portal vein receives oxygenated blood from the umbilical vein and continues to the ductus venosus. And then ductus venosus join the IVC, and here we can see the heart. So it drains the blood into the right atrium. So umbilical vein carries the oxygenated blood from the placenta to the fetus, enters the fetal liver at the abdominal cord insertion site. 50% of the umbilical venous blood is shunted through the ductus venosus to the IVC before entering the right atrium. So here we can see umbilical cord, and then umbilical vein enters into the liver, and then left portal vein receives oxygenated blood from the umbilical vein, and then they enters into the ductus venosus, which drains into the IVC. So here we can see a route from umbilical vein to ductus venosus, and then through IVC it drains into the right atrium. And here we can see the color flow image of this vessel. So we can see here ductus venosus and IVC joining the heart. So foramen ovale. Foramen ovale is like a door between the heart's room. So it is a door that lets blood pass from the right atrium directly to the left atrium, and it bypasses the lungs. Because the fetus have no need for the lungs, because placenta is taking care of the fetus very well. Placenta is providing the oxygen. So here we can see fetal heart, and we can see right atrium here, right ventricle here. We can see left atrium and left ventricle. So between the right atrium and left atrium, we can see this opening, this passage. So this passage here is the foramen ovale. Okay, so now about lungs. So lungs are closed here. So here comes the role of the ductus arteriosus. It's a final shortcut. Like majority of the blood, it directly moves to the left atrium, and from the left atrium it is supplied to the whole body, left atrium, left ventricle, and then it is supplied to the whole body. And remaining, like some of the blood which goes to the right ventricle, it have to bypass the lungs. Normally from the right ventricle, blood goes to the pulmonary vessels and go to the lungs, but we have to avoid it. So after blood leaves the right ventricle, there is now need of another shortcut, that is the ductus arteriosus, which connects the pulmonary artery, which normally send blood to the lungs. So now it bypasses through the ductus arteriosus. So pulmonary artery directly join the aorta. And how it joins the aorta? Through the ductus arteriosus. So this helps to bypass the lungs and directly enter into the aorta. So this is another shortcut. Okay, now any one of you can please summarize what we have discussed about fetal circulation? Medium, can you please summarize this?
Yeah, I can try.
Okay.
Yes, the fetal circulation.
Okay, let me try, ma.
Facilitated by the umbilical cord, which connects the fetus to the placenta. Now, the umbilical cord has 3 vessels, 2 arteries and 1 vein. The arteries carry deoxygenated blood to the placenta, which acts as an exit route, while the umbilical vein, carries oxygenated blood from the placenta towards the fetus, which is an entry point. Now, the umbilical arteries originate from the internal iliac arteries. Now, the fetal circulation, when the blood enters into the fetus, it goes directly to the heart because they do not. Oxygen and glucose is provided mainly by the placenta, so we are not worried about supply of oxygen and the nutrients. Now, we do not need blood to go through the liver, so there is a bypass or a shunt that directs blood to the right side of the arch, and that is the ductus venosus, where we have the umbilical vein, the left portal vein, then ductus venosus, which will connect to the IVC to the right atrium. Now, once the blood enters into the right atrium, normally in a dot, from the right atrium, the blood goes to the right ventricle. Now, we do not need blood to go to the right ventricle because from the right ventricle, normally blood is pumped to the lungs through the pulmonary arteries. Now, the blood is already full of oxygen, so we are going to bypass the right ventricle through a shunt, that is the foramen ovale, which will direct the blood from the right atrium to the left atrium. Now, to bypass, and then from the right atrium, the blood will go direct to the aorta, which will go through the ductus arteriosus. Now that we do not, the blood does not go through the lungs for oxygenation normally, and that is where we have the ductus arteriosus, which is a bypass that bypasses the fetal lungs and then goes straight to the body. That is through the aorta, connects the aorta. Yeah.
Exactly. Very good. So now after birth, what happens? Now there is use. Now there will be need of the use of the lungs. So now all the shortcut path closes. Why? Because now there is no placenta. Now fetal organs have to take the responsibility. So once the baby starts breathing, foramen ovale, ductus venosus, ductus arteriosus, all these temporary shortcuts now shut down because now body realize that now it's time for the lungs to take over because now there is no placenta and the baby needs oxygen. So lungs take over and body starts using the lungs and they start performing their function. Okay, Stanley, can you please now summarize this?
Please, I'm with patient now, please.
Okay, I understand. No worries. So umbilical cord is the main highway for the oxygen and nutrients. Ductus venosus is the secret tunnel that skips the liver. Foramen ovale is a shortcut door between the heart's rooms, and ductus arteriosus helps skipping the lungs. And after birth, there is time for regular roads, and the lungs they now start performing their normal function.